Hi, I'm Lisa Davies, and I am the Chief Executive Officer of Chapa-De Indian Health. One of the biggest reasons I think for our success is that we really have an allegiance to our mission, and that we have a lot of respect for that relationship between a provider and a patient. And so we build our system around connection rather than like a conveyor belt and processing patients. What I want any new or potentially new employee to know is that when you come to Chapa-De, what we need most from you is your heart and your brain. We want you to have compassion. We want you to have skills and competence. What we don't need from you is your endurance or your stamina. We want you to go home at the end of the day and have enough energy to spend time with those you love.
So there's not many places where you're not just a cog in the machine and you're looked at as talent, and Chapa-De is one of those places that from the leadership level, they really look at providers as the voice for their patients. And so there's been a lot of initiatives that providers have put forward to really further that cause.
I really like working at Chapa-De versus a private practice because we are able to see patients and just really focus on them. We have an excellent team that provides supplies for us, make sure everything is running properly, so that allows me and my team to make sure we're providing the best quality care for our patients. One of the most rewarding aspects of working at Chapa-De as a dental provider is that our patients are extremely grateful for what we do here. On top of that, we have a great atmosphere. It's very warm and nurturing, and everybody just wants to do the best that they can for the patients, and it makes my work so much easier and more fun. There are a lot of great benefits of being a dental provider at Chapa-De, including loan repayment, health insurance, smaller panel sizes. We have great teamwork atmosphere, so it makes everything feel like we're part of the family.
For over 40 years, Chapa-De has been operating in Northern California, providing exceptional care to the communities that we serve. As our communities have grown and evolved, our organization has grown and evolved to meet their needs. And so now we're operating 2 health centers, one in Auburn and one in Grass Valley, California.
When I first started, just working like normal hours, Monday through Friday was fantastic. So I had really good work-life balance. But after I've been here about a year, we decided to start a family. So that's been a fun new adventure in terms of work-life balance. I wasn't sure how it was gonna go in terms of coming back to work, and I felt really supported. So getting out on time has become a huge priority, and I would say that that's pretty easy to do here.
For me, as somebody who has grown up using Indian Health Services and working at other Indian Health Service facilities, and seeing where they strive to be, once coming to Chapa-De, I realized that Chapa-De is doing it, and this is what Indian Health Service should be, and I'm just glad that I get to be a part of it.
I think what's important to me is I came from a private office where the focus I felt like was more on selling treatment to our patients and meeting goals. I feel Chapa-De offers a lot of flexibility to their staff. I also get to experience a lot of variety here with the type of care that we offer. I get to work at the height of my license, which is really important to me. It makes me feel like there's trust and confidence in me that I know how to do my job and that I get to focus on treating patients.
So our CEO created a employee engagement council, which is an advisory group of people to give direct lines of communication to her and the rest of the leadership team. And so Joe's one of those staff that are part of that team. And what's so great is what is different about us is that we actually use that and value that contribution, because
Correct.
You know, when we're thinking about new things that we want to implement, we have a way to get feedback from the staff on how's it going to work, which is awesome that we're listening and want to hear that.
Absolutely, and that's something unique to this company. I don't know if I've worked somewhere where the voices are as weighted, as valued as they are here.
Yeah.
As a nurse, you work a lot of nights, weekends, holidays, and here at Chapa-De, we work normal work hours, 8 to 5, an hour off for lunch, and as a general rule, no nights, weekends, or holidays.
So I've worked in larger health systems before, and what has led me here to Chapa-De and what I'm attracted to with Chapa-De is it's small enough that we have a family feel, and the staff and the administration have a real pulse for the population that we serve.
So I don't provide direct patient care, but the best thing I can do for patients is to make sure that our staff is well cared for, and to that end we spend a lot of time evaluating compensation and benefits and looking at our infrastructure to make sure that we have the resources that our staff need to be able to provide care that they can be proud of at the end of the day when they go home.